The full breadth of people that need help from cradle to grave.
He's an emergency physician here at Queen Elizabeth Hospital.
You can tell patients who don't have a family physician, whether it's something as simple as a prescription refill or chronic illnesses that aren't managed, or a devastating diagnosis that you have to give to a patient. And I shouldn't be doing that. I shouldn't be having to give such bad news to patients on a shift when having access to primary care would be so helpful.
So do you see examples of someone who might not have had that devastating diagnosis if they'd had a family doctor?
Yeah, case comes to mind just 8 weeks ago. A patient came in with an issue. We were concerned. We did investigations, and as the images came up, I said to my colleague, I said, I'm going to go in and I'm going to be ruining those people's lives. And give a devastating diagnosis that could have been picked up by primary care if they had access.
You think it would have been?
Oh, in this case, absolutely. Absolutely.
So as a longtime resident of this province, as a longtime physician in this province, how do you feel about this shortage?
If we have solid primary care, it touches on every other aspect of healthcare: preventative medicine, addictions, mental health, cardiovascular disease, pulmonary disease, all the things that we see some patients for in the emergency department. And it's a team effort. I'm not trained in primary care. I'm an emergency physician, but we try to do primary care. Family docs are primary care specialists, and they need to be valued and treasured.
Our question, how are you coping without a family doctor? What impact has it had on your health? This is Country Checkup, your voice, Canada's voice for 60 years. And let's begin the program with Erica Shepard, who has joined me here in our CBC Charlottetown studio. And you lost your family doctor just last August, I guess, right? What impact has that had on you?
Huge. I've been without a certain medication. I was monitored monthly by my family doctor, and it's affecting me physically, mentally, everything.
Complicated by the fact that you're dealing with some really significant kidney problems. So describe for me what it's like trying to manage your illnesses, because I think there are a few things that you're dealing with without having a family doc that you can talk to.
It's frustrating. It's a full-time job, having to look after myself. I've had to think about going to the ER, and last time I was there, it was 13 hours to be seen for 2 minutes. It's frustrating. It's upsetting. I don't have any answers. I don't know what to do.
I think really what we need to be talking about is a reallocation of some of the funds. 100% of Canadians need access to primary care, yet only 5% of the budget is provincially and federally for healthcare is headed towards primary care. That is almost exclusively to physician payments. And while family physicians need to be paid appropriately, we need to be able to organize family physicians in a way that everybody is going to get access. Just to go back to that school analogy, we want to make sure that teachers are well paid, but also that they have a place to go to school. And then in every community, you know where you go to sign your kid up for school. Wouldn't that be amazing if we had that same infrastructure in Canada, where in your community, here's the community health center that you can go to? So I'd like to urge people to be asking questions about what kind of funding shifts do we need to see from acute care and administration to primary care.
Stephen Cook has called us up. Tell me your story.
Back in January, February, I went in with a lot of pain and found out that my family doctor was no longer my family doctor. He moved on and made me see a nurse practitioner who knew nothing about me. When I told her I was in pain, and I was told, no, we're not going to give you anything. We'll set you up for these tests. So 3 months go by, and I get a call from the same nurse practitioner asking me why my file was still open. And I said, because you were supposed to book an appointment for me. So after 7 months now, I'm myself had to reach out to the colonoscopy department and say, I've been waiting almost a year. I'm in pain. So I went in May to have my test. And before I even got home and walked in the door, my phone rang, and it was the nurse practitioner telling me to go to the emergency room as fast as you can go. I got to the emergency room, didn't have to wait, obviously. And they took me in a room and told me that I had colon cancer, a 50-centimeter tumor that, if found earlier, I would have got to survive. And since it spread to my kidneys and my liver, I'm not going to be seeing my 60th birthday.
Oh, Stephen,
And
I'm
there's
so
nothing
sorry.
you can do about it.
The approach, I think, has to really have three components. I think we have to ramp up the way in which we bring in people and train people to become doctors. We have to rethink that paradigm, which is rooted in a decades-old reality, which is basically that all doctors did the same thing. We have to also put our doctors into environments where they can be efficient and do their jobs well and do them and do what they need to do what doctors do, basically. And I think the third thing that you're alluding to is we need to find ways to bring in and to increase the number of doctors that we are able to bring into Canada to do those kind of jobs that are so needed. It's important also to understand that there's no shortage of young people in Canada who want to be doctors. Every year, medical schools turn away thousands of young people who are, frankly, very qualified and would be wonderful doctors, but we don't have seats for them. They go off and train in other countries, many of them, and they tend to stay in those other countries and not bring those skills back to Canada. So I think it's going to take a three-pronged approach.
Thank you very much for taking my call.
Yeah, and so you don't have a family doctor. Tell me your story.
Well, in 2015, I moved here to be with my daughter. I waited 2 years to get a doctor. She was lovely. I lost her 2 months ago. And I phoned the number that they told me to call to get on the list for a new doctor. I'm 74 years old, living on my own on a pension, and was told the wait was 6 to 8 years. It's pretty daunting.
Yeah.
So it's a very bad situation up here. Hi there, Ian. Thanks for taking the call.
Yeah, you're very welcome. So you have immigrated here from the U.S. How have you done trying to get a family doctor here?
I am coming on my 10 years of being in Canada, back and forth. I feel like we've been told that healthcare is a right, and we all pay a lot of taxes to pay for that. And yet, if we don't have access to healthcare, it doesn't actually work at all. I mean, yeah, and I'm very, very distraught to the point where, I am going to get my citizenship to have it, especially in today's day and age. However, I'm not sure I'm going to stay in Canada.
That family medicine is all about relationships. We go to school for eons. We spend thousands of hours with supervised training. But when it comes right down to it, we are family doctors because we like people and relationships. And when I'm listening to her story, and it's just like, oh, I can just feel it. And there's so many stories out there. And I actually get asked multiple times a week if I'm taking on new patients.
Are you taking on new patients?
I'm not. And I've had to put a blanket statement in place because I get asked so often, and everyone is so deserving. There's nobody who doesn't, and you just wish you could do it all. But
it must be tough for you.
Because
I mean, I've got people in my family in British Columbia who don't have a family doctor, and I feel like anytime I'm at a party and somebody says they're family physician, it's like, hey, what about seeing her? You must run into that on the island all the time.
All the time. I mean, the island's a small place. So lots of people around. People know you. I actually was sitting watching my daughter finish up her practice today, and the mom sitting next to me, oh, so I hear you're a family doctor. And I'm like, yeah. And I'm waiting for the question. And I would never say don't ask. You never know. I'll keep asking. The worst we can say is no, but it's heartbreaking to have to say no sometimes. But I know that if I took everyone, then no one would get good care. And again, when it comes down to the patients and the people, my job is to provide care and the best care that I can.